one of our affiliation hospitals where the residents can improve their knowledge and skill. Faculty of Medicine at Langga University is the second oldest faculty in Indonesia. Dr. Sutomo Hospital is a public hospital owned by the government with most complete services. in East Indonesia. In its development, Dr. Sutomo Hospital continues to develop Central Laboratory of Clinical Pathology. Clinical Pathology Department also has 5 divisions of subspecialization program, established 2015. Other than that, provide solutions that can help maintain and overcome health problems until now. Clinical pathologists and all the residents always give the best effort to be the leader of education and service to support the vision and mission of Dr. Sutomo Hospital. The Central Laboratory strives to continuously improve and maintain good quality services in accordance with international standards. The long and winding journey has been traversed by the faculty in its efforts to transform the knowledge in the field of medical science and devote science to improve the welfare of the nation, the state, and humanity. Teaching Hospital is one of our affiliation hospitals where the residents can improve their knowledge and skills. Assalamualaikum, Prof. Narazah.
Waalaikumsalam, Dr. Rofida.
Yeah, good afternoon, Prof.
Good afternoon to everyone.
Yeah, can we start our scientific lecture, Prof?
Yes.
Yeah, thank you very much. Assalamualaikum warahmatullahi wabarakatuh. Good afternoon, ladies and gentlemen. Welcome to Scientific Writing Lecture Series in Clinical Pathology Department. This webinar is organized by Faculty of Medicine Universitas Airlangga in collaboration with Clinical Pathology Department. My name is Rofida, and I'm very delighted to have professors, doctors, and colleagues at this event today. Yesterday, we have learned about writing high-impact journals articles, and today we will continue with the scientific writing lecture that will discuss about publication of a case report or case study and a technical report by Professor Narazah, Master of Science, PhD. Before we jump to the lecture, please kindly see the agenda for today. Narazah, and then we will continue with the discussion. And after that, we will continue with the photo session. And today's lecture and discussion will be led by moderator, Dr. Puspa Wardani, Clinical Pathology Consultant. Dr. Puspa, time is yours.
Thank you, Dr. Rafida. Can you hear my voice?
Yes, doctor, we can hear your voice.
How do you do, Prof. Narazah? Alhamdulillah, we can meet again in this session. So I will start this discussion and lecture from Prof. Narazah. Selamat sore, good afternoon. Assalamualaikum warahmatullahi wabarakatuh. First of all, let us praise and thank to the presence of Allah Subhanahu wa Ta'ala for the abundance of grace and joy of all of us, so we can still attend this meeting discussion today. And I would like to say thank you and deep appreciation to Prof. Narazah, Professor Dr. Narazah Muhammad Yusoff, MBBS, DCP, Master Medical Science PhD from USA, Malaysia, for the time that share with us right now. And this time the topic is publication of case reports, case study, and technical report. So we hope this lecture will help all of us in the clinical pathology of University Airlangga to improve the quality in publication, especially in case report and technical report. So please, Prof. Narazah, to proceed your lecture.
Okay, thank you, Dr. Rofida, and also Dr. Pushpa. It's a pleasure to see Dr. Pushpa again, even though we are online.
Yeah.
And it's also a pleasure to be here again to share with you our experience as well in publishing case reports. Yeah. So I will stop my video and start sharing the slides now. All right. So everybody can see now, right? I will just move.
Okay. Already seen, Prof.
All right. Okay, I'll move some of this, by the side. All right. The topics that we are going to cover today in a publication of case report or case study is why are case reports essential for us as clinicians, and then how to prepare for submission, and how do we handle editors' decision comments by the reviewers, which I didn't mention yesterday, but since I'm going to mention today, is basically the same, follow the same principles as to whether you submit a case report or case study as opposed to submission or handling editor's decision pertaining to submission of original or research papers. So the basics, the fundamentals, the principles are the same. All right. So first, sometimes we think that case reports are difficult to be submitted. All right. One is because some journals do not accept case reports. But even though that's the situation, case reports are important for us as clinicians. All right. So case report is a detailed report of a patient, followed by discussion of the learning points from this case. All right. And then, as opposed to case series, it's a type of medical research study that tracks patients with a known knowledge, with a known exposure and outcome. All right. So case report is a single case of a patient, and then case series is a more than it's a series of patients that track subjects with with known exposure and outcome. Okay, that is difference between case report and case studies. All right. How to get rid of this. Okay. So why are case reports important for us as clinicians? Much as we enjoy reading a tale of horror, I think we feel that whenever you see a case report, you are obliged or you feel interested to read about the case reports, and never ever think that a case report, the value is not as important as original or research publications. All right. So most of us enjoy reading a tale of horror. All right, and at the same time, we also enjoy reading about single case study, because that's the learning point of management, for example, new management. All right. And case report is still regarded as one of the first line of evidence in medical science. All right. Case report is still regarded as the first line, one of the first line of evidence in medical science. Because the reason why I say so is because there are numerous examples where initial dissemination of knowledge, especially the breakthrough knowledge, has been done with the help of case reports. All right. So, case report can also be a breakthrough and can help in stimulating further research, for example, or in changing the management of patients, for example. All right. Okay. So case reports, they attract readers, all right, who may not look at other articles in the same detail. Okay, usually when you see a case report, usually it's very short. It can, it's a one page and then coupled with images, interesting images. You can just read it. Just read it immediately, okay, or you feel attracted to read it, as opposed to research or original research articles. You feel that you want to get to you want to know at the end of the story, and it's short usually. All right. Okay. So the other reason why case reports are important for clinicians, because it adds to our knowledge for rare cases. All right. For example, here, concurrent COVID-19 and Kawasaki disease, novel virus, novel virus and novel case. All right. So this is during the earlier emergence of COVID-19. So no one has ever reported yet a concurrent disease with Kawasaki disease. So this proved to be novel as well. All right. So it adds knowledge to our knowledge of rare cases. Okay. The other thing is case reports have more chances of acceptance. Okay, I'll put it down then. Case reports usually have more chances of acceptance if they provide a message pertaining to clinical practice, especially ability to alter the clinical practice, something that is new, something that is, relevant to the present clinical practice, which is, change the current that people have been practicing traditionally. All right. So they have more chances of being acceptance. So these are the categories. All right. And the other reason for case reports to have more chances of acceptance if they add to the existing knowledge, raise a novel research question. All right. And this novel research question has the potential of generating a large scale research. So in these two circumstances, there are higher chances of acceptance. All right. But it's not really confined to these two situations only. So let's see how we want to increase our chances of ensuring that our case reports are accepted. Okay. So the other reason why case reports are important for clinicians, as I said, improve our practice. For example, Nipah virus, Ebola virus, Zika virus, SARS, H1N1, the first case of, Nipah virus, for example, the first case Ebola virus. All right. So during the earlier emergence of COVID, all right, New England Journal of Medicine invite authors to share case reports of patients that they have treated with COVID-19 in the hospital. So here, sharing experiences of patients in different institutions can help to inform others around the world. Other benefits, case report is relatively easy to complete, and then it also provides a good opportunity for young physicians to get acquainted with the nitty-gritties of writing a scientific article. It means here that, a young researcher, the minute his case reports, his first ever write-up is about a case report. So the case report is accepted by a journal. So this will encourage him to write more and also stimulate him to write, more detailed scientific paper, for example, or the original research article. Okay. And not only that, writing a case report and having it published also give credit to the institution or department. This is very clear cut. And eventually also, it will also help to promote your career because of your ability to publish. It can help your promotion as well. Okay. If you have shared, your knowledge, actually sharing of knowledge, how you treat a patient. For example, you have managed a difficult case. There are many lessons learned, all right? And usually you do not want to share it. You do not want to share it with the rest of the world by publishing it, all right? So this is not the concept. All right, so we would like to share with the rest of the world. So if you take this approach, you're not doing justice to the patient or the participant. All right, so it's good to share, share so that other people can follow how you manage a difficult case. And it is, of course, important for patients as well, should the clinicians encounter a similar case. So after he has read your case reports, so he will know what to do. So it's a sharing of knowledge as well. There's no doubt about that, all right? So this is one of the ibadah as well. All right. Okay, so as the saying goes, sharing knowledge of how you treat difficult cases, for example, when you share, the society will grow. And then as you see in the slide, society grows great when men plant trees whose shade they know that they shall never see it. That means you are sharing for the younger population, for the younger generation. You sow a seed and then the seed grow into the plant. You may not be there anymore, all right? But the future generation will benefit from the trees that you have sowed and planted, all right? So as the saying goes, the words, if I quote the words of William Osler, father of modern medicine, always note and record the unusual, publish it, place it on permanent record as a short, concise note. Such communications are always valuable. This still hold relevance in today's era, all right? Okay, how to prepare for submission? When to write, okay? Do you write only when you encounter an interesting case or interesting situation? Okay, so the best time is even before the case even come to you. All right, why do I say that? You can be prepared, all right? Do you have a good case? You can be prepared in the sense that you can make the classification, all right? For example, you put into a table the cases that are unexpected and unreported presentations of a disease. All right, a disease that has unusual presentation. You can start with this main topic first, and then you can, gradually as you move on, you have examples of unexpected, unreported presentation of the disease. Also, you may also classify, under management of new and emerging diseases. Also under the title unexpected and underreported event in treating a patient, a novel and unreported method of management, unreported adverse drug reaction, all right? This also can be, classified under case reporting. Findings that shed new light on pathogenesis, equipment problems. See, even as in the lab, we may encounter situations where there are equipment problems and you do troubleshooting. You may want to convert this into a case report as well, all right? And an unusual scenario followed by a short review of existing literature, all right? So even if you don't encounter, you can, still be prepared by doing these classifications, and then you just, if whenever you encounter, related case, you can go into this classification, all right? So it's worthwhile to have to be prepared and have the classifications ready. Otherwise, you will not, you think that you are always not prepared to write case reports. So you may have other categories besides these 8 categories as well, okay? So it's up to you to think further what other categories that you may want or interested to write in, okay? So now you have a good case. So for example, you already have a good case to write, which falls under one of this category, okay? So you're excited. First things first, get the things ready first. The 2 most important steps are consent from the patient for publication, all right? Whenever you're writing case report, you must get consent, and the journals want to see the consent, no matter how simple, how whether you only get the images, or you get the blood, you get the samples, you don't interview the patient, but you must get the consent for publication. So consent usually is required by almost all journals, otherwise they won't publish. All right. And other important step is you must get a high resolution photo, especially when to show clinical findings, sign and symptoms. All right. So a high resolution photo is very important. So you have to be ready all the time, because you may not have the chance to see that the sign again. It will disappear. For example, if you see the patient at the casualty, okay, and then take the photo immediately. All right, take the photo. Of course, you get the consent later on. All right, and there are also regulations of how you take the photo as well. How you publish the photo. So a high resolution photo is important where where it is significance. And then you have to think in one sentence, what is so special about the case? All right. So why do you want to, why do you aim to write about this case? What is so special about the case? So here you can refer back to the categories that you have prepared earlier. All right. For example, unusual presentation, okay, and then very obvious clinical sign that has not been shown before in other reports. All right. So we'll see the examples afterwards. Okay, good pictures. Why is it important? Increase the chances of acceptance, right? So, for example, here, images in dermatology, all right? Neglected Huminger melanocchia resulting in melanoma. All right. So here, it shows the photo shows a patient had ulcerated plum to black colored tumor involving her left thumb. Okay, it's very obvious. It looks very, very eerie looking. All right, but it can attract the reviewers or the editor. All right, in this case. Okay, and the other example, a good photo that shows clearly here gingival hypertrophic lesions with severe periodontal disease suggesting of scurvy. All right, you can see here the periodontal lesion. Okay, so this is a case of malnourished, unusual case of heart failure. All right, the patient has malnourished. So, a good photo that shows clearly the clinical the signs that you want to emphasize here. All right, so what about this? If you see here, severe acute watery diarrhea in an adult. Acute watery diarrhea in an adult is not shall say novel, but the reason why it is accepted here is because they have key learning points here. For example, cholera patients with severe dehydration may also be treated with appropriate antimicrobial agent. All right. And then, although optimal prevention of cholera includes provision of safe water and adequate sanitation, such goals may not be feasible in short or medium term for those most affected by cholera. Okay, suggesting that cholera vaccine may need to be used more widely. All right. So this again shows the state of the patient on presentation. All right. And then, all right, this is example of one of our clinician who is ENT surgeon. All right, he published this image in New England Journal of Medicine. Just a simple case report. As you know, New England Journal of Medicine, the impact factor is 70, and he presented a man with Ludwig's angina. Okay, it's not angina heart per se. So Ludwig's angina is a form of cellulitis. And, the cellulitis arise in the submandibular and then the submental area. You can see the swollen neck here. And on top of that, he also has swelling of the gum. All right. So the swelling of the gum, clearly indicate here that it looks as if the patient has double tongue, all right? Whereas the tongue is up here and is also being moved backwards, all right? But the picture is very clear. It shows, and it jives with the title, Double Tongue, Appearance in Ludwig's Angina, all right? So this is due to bacterial infection. The report was very, very brief, very short. So it is essential here. The journal decided to to publish this because if you search the literature, there's many cases have been reported about Ludwig's angina. So what's so special about this case? All right, so it attracts the audience because one, it's ENT case, but not only that, it is it's emergency, needs urgent attention. The patient may have respiratory failure because of swelling of the the swelling can spread, cellulitis can spread also, can cause obstruction, respiratory obstruction as well, respiratory distress. And so it is an emergency situation. Patient may require tracheostomy as well, but the image that you see here is very clear. The double tongue, that it attracts the audience or the readers. You see the double tongue here. All right. So this is not novel. It has been reported elsewhere, but because probably the image is very clear, all right, and well, that's the success story. Okay, so how do you write a case report? Of course, it must have title, it must have abstract and keywords. All right, keywords, as we mentioned yesterday, the keywords must, if possible, try to get the standard keywords that have been used in the database, for example, Scopus keywords, and then the case report must contain a little bit about introduction, and then the report itself, the case report, the presentation, and then discussion and conclusion, and must have figures and tables where relevant. All right, so this is the format. This is the usual format: the title, abstract, keywords, introduction, the case presentation, discussion, conclusion, and figures and tables where relevant. Okay, selecting a title, it must be catchy. Avoid like promoting, self-boosting yourself, for example, rare, unusual, successful management. This is like, we say angkat bakul, all right? So suggestions that you can use instead of, to avoid self-boosting. You can choose titles, for example, hidden, mimic, novel, refractory, neglected, and review of literature, for example, if you want to review the literature. Okay, so these words are more subtle, not showing that you want to overemphasize your findings, but it is attractive. We see the examples here. All right, so for example here, splice mutation in P53 gene, case report and review of the literature. Nothing being said about novel or rare and whatnot. So another example is BMC medical genetics. This keratogenesis congenita with a novel genetic variant in the DKC1 gene, case report. Okay. The other one is, another example, cutaneous manifestation mimicking Stevens-Johnson syndrome in a critically ill patient. Looks similar but totally different. So, well, everything says there in the title, cutaneous manifestation mimicking Johnson syndrome in a critically ill patient. It looks similar but totally different causes. All right. And then another journal case description about, a misdiagnosed infection mimicking three-man disease. All right. So here mimicking, a lot have been said about Down syndrome. Okay. And then this is, another interesting case, where the title is catchy enough as well. Okay, and then again, another, case report, novel, sporadic desmoid tumor with mutation of beta-catenin gene. All right, and again, the word novel, make sure that you have done extensive literature when you say novel, all right? Otherwise, it will be rejected if, there are cases already. So this is, overclaiming it to be novel. All right, and then here the word hidden, all right, hidden male factor, occult, foreign body, and diabetic foot. Okay, so the word again, hidden. Hidden is the word, it's not that it's hidden, but the title carries the word hidden. Okay, and then, a refractory cutaneous abscess. All right, so these are the titles that are catchy, that are not, self-boosting, but of interest. And then, all right, once you have choose the title, the abstract, draft the abstract, draft a sentence of the case and the learning point. What do you want the readers to gather? What is the learning point? Why do you want the readers to read this one? And what will attract the editors, the reviewers, as well. Okay, so what's the learning point? So once you have drafted the case and the learning point, you can elaborate on that. Okay, elaboration usually not too long. Abstract is, it depends also on the journal itself. Okay, usually it's about 150 to 200 words. So stick to the, to the number of words that has been allocated. And then, usually, you can follow this proportion, 1, 2, 4, and 1. All right. Proportion is one portion is on objective, the knowledge gap, and then on the 2 portions on the case itself, the case presentation, and then 4 portions on discussion and literature review, and the last portion is on conclusion. All right. So these are a rough guide of how much to put in each different sections. All right. So introduction itself, you can also use the proportion or the ratio method. So the background, okay, you need to have an introduction. So what is known about that case in the proportion of 3, and then knowledge gap, the unknown info, and then the objective, the aim. Don't elaborate, all right? So be crisp and be concise, the objective. All right, the case report itself. Once you go to the case report, the presentation, usually this is the easiest section to write, the clinical information, the presentation, the investigations. So you can start with this first. Start with this part because you can get this from the patient's note. Okay, you can summarize and then simplify. And the usual grammar or sentence to use is in passive form. All right, use passive sentence because it sounds more professional. So passive sentence sound more professional. For example, example of passive sentences are, the objective, what is the subject, the verb, and then ensure what are the subject, the subject, the object, and the verb. Okay, so this is an example of passive sentence. We treated the patient with hydroxychloroquine. All right, as opposed to a passive sentence, the active sentence will sound like this: the patient was treated with hydroxychloroquine. All right, so here we becomes the the object. All right, and then treat is the verb, patient is the subject. So use passive sentence. Okay, so these are examples of passive sentences. It is more professional. And then skip event or locations. We is all part of our nature. You want to be as detailed as possible. So try to skip, try to skip all this information, because the readers may have know already where you are located, where the patient is treated. So don't repeat. So for example here, the original statement was the patient presented to the specialist clinic of Advanced Medical and Dental Institute USM with vomiting of blood. You can delete all this, disregard all this, because you already know the patient presented to the clinic of USM, of IPPT. Okay, so skip all this, just skip and leave it. The patient presented with vomiting of blood. Okay, so be simple. Don't put irrelevant information. Okay, so the patient was treated with hydroxychloroquine. All right, so this is a passive passive instead of active. We treated the patient with hydroxychloroquine. Sorry about the misinterpretation of the sentences here. So here you can see that the statement here, we treated the patient with hydroxychloroquine as opposed to the patient was treated with hydroxychloroquine. So we treated is the active. Okay, I made a wrong assumption just now, made a wrong deduction. So the better way, sound more professional, of instead saying we treated the patient with hydroxychloroquine, it should be in passive. The patient was treated with hydroxychloroquine. All right, so we disregard or we skip we treated. We just say straight away the patient was treated with hydroxychloroquine. So this example of passive sentence. Okay, so here a better way is the patient presented with vomiting of blood. Okay, so figures use the highest resolution possible. If a phone camera is used, send via email, not WhatsApp, to the journal. And sometimes you may combine two pictures under a figure. Okay, there are ways of doing it. For example, micro using PowerPoint. Right, you may want to use two pictures rather than one. So you can combine that under a figure. All right. So for discussion, in one article, focus only on 1 to 3 points. Okay, what are the important points? And if you have 10 points, so it doesn't merit to be a case discussion, all right, or case report. Because if you have 10 points, then you should write 3 articles. All right. And then, of course, you have to study the literature well and fill up the knowledge gap before, over-claiming, over-boosting novel, And it's good to have a good literature review. Compare your case with other available cases. So I'll show examples here. Okay. For example, we have a paper here that, we can look further. What do you mean by good extensive literature review? Dengue plus malaria infection. We know that dengue and malaria infection is nothing new, has been reported many a times. Already many cases have been reported. So you do a further search. All right. So you see here the table, So it has been reported. Okay, you see here table 1, case reports and case series of co-infection with Plasmodium and dengue virus. This is, systematic study or systematic review. All right. So there are many cases that have been reported. Okay, from 2005 until 2012. So here case reports and case series of co-infection with Plasmodium and dengue. So what's so novel about the case report that you want to study. So you may think that, okay, I will stop here because there are already already many cases that have been reported pertaining to double infection, dengue and malaria infection. Okay, but when you do further search, okay, dengue and Plasmodium knowlesi has never been reported. All right, so you see here that when you do further search is also in malaria, dengue and malaria, but not in Plasmodium malaria or the malaria Plasmodium knowlesi. So never been reported. All right. So this is example of you to do a extensive literature search. All right. Otherwise, if you don't read out further these review articles, these case reports, you may think that they have already reported using with malaria plasmodium, but it says that all these malaria infection together with dengue cases, dengue infection, they have been reported in other kinds of Plasmodium, not knowlesi. So there you are. So this has never been reported. All right. So because of that, this paper was accepted and published. All right. So the dangers of accepting a single diagnosis case report of concurrent Plasmodium knowlesi malaria and dengue infection. So it's been reported in Malaria Journal. If I'm not mistaken, this is a Q1 journal. All right. Okay, example 2, when I said, must do a literature review. Example 2 is concurrent actinomycosis and malignancy. Already there are 12 cases that have been reported. Okay, so again, we look at the literature review. All right, so concomitant, remember concomitant actinomycosis and malignancy. So we look at all the 12 cases that have been reported. Okay, cases identified through a systematic review of concurrent actinomycosis and malignancy. So the first author, reported about actinomycosis on diffuse large cell lymphoma, and then another author, lung squamous cell CA, and then non-Hodgkin lymphoma, another case of lymphoma, and then one colon cancer, okay, and then actinomycosis in ALL, another case reported, 2 cases non-Hodgkin, and then another lymphoma, Ewing sarcoma, AML, and B-cell lymphoma. It seems that almost all the 12 cases were reported in hematological malignancies, and only 3 were reported in other types of malignancy. So after literature search, after comparing and analyzing, it's noted most of the co-infection affect hematological malignancies. Okay, so here you are. All right. So the case report of concomitant actinomycosis malignancy, all right, outcome of the thorough literature review, it was accepted. So the title goes as Masking and Misleading Concomitant Actinomycosis and B-cell lymphoma, a case report and a review of the literature. So this is example 2, concomitant actinomycosis and malignancy. Okay. And then your reference preferably must be as recent as possible, okay, at least for the last 5 years. By using EndNote or Mendeley, it's quite easy to look, how to go about. You can refer to YouTube's how to go about, doing the EndNote or Mendeley. And then cite 1 or 2 articles in the journal that you want to submit. You don't have to, in case report, you don't have to do a lot of references, okay? Language, for the language here, use simple language, and then preferably check, ask your colleague to check from the different field, because they may find a different, they might detect things that you don't detect if you are in the same field. Okay, and you can also get the use of language checking service as well. So it's good to have a simple language. If you can't explain it simply, you don't understand it well enough. Okay, selecting a journal. There are some journals who accept case report. There are some journals who do not accept case report. For example, BMJ, British Medical Journal, there's a special journal, a special issue that focuses only on BMJ case report. And then we have other examples, for example, PMC, PLOS, and then you can always check with Scopus and JCR Clarivate database, all right, to see which are the journals that accept case report, and which are the journals, ensure that the journals are trustworthy journals as well. Paid journal versus free journal, there are pros and cons, all right. And for us in Malaysia, we have local journals also who publish case reports. For example, MJMS, Malaysian Journal, Malaysian Journal of Medicine, Malaysian Journal of Medical Science, Malaysian Journal of Medical and Health Science, and then IPPT, we have our own journal, which I already mentioned yesterday. And then ensure that you avoid the predatory journal. You can check from the website here which are the predatory journals. So make sure that you don't publish in predatory journals. Okay, usually predatory journals, they promise short, very fast reviewer time, but this comes with a price. That's one. Secondly, if you publish your report in predatory journal, it can also potentially spoil or tarnish your reputation. Not only your reputation, but the institute's reputation as well. Okay, so you can check which are the predatory journals. All right. And as I said, check with Scopus, check with JR Clarivate to see the impact factor, the quartile information as well. Okay, to check the journal's impact, and also the performance of the journal. All right. So these are examples how we check with Scopus, and then how we check with JCR Clarivate database. So I need not show again this one, our journal. Okay, so now you want to submit. You have done everything. You already choose your journal. You want to submit. So again, you have to read the author's instruction. It will vary from journal to journal, and you must write a good cover letter. Okay, and the manuscript must contain a good abstract. All right. So this is an example of how you get the information about author's instruction, and then manuscript. The guideline about the manuscript, it may differ from one another. So this is example of a letter. All right, cover letter. Okay, so yesterday we were talking about cover letter. So the letter address the editor by the name is more personal. And then mention about the title of the article. All right, here, difficult mass ventilation, single step to make it the impossible becomes possible. All right, so tell what are the attractive things about this case report. All right. So you elaborate a bit, and as I said yesterday, it is not an abstract. Okay, so you have to tell what is the interesting that will be the readers will find. All right. So here they mention about difficult ventilation, and then they share the successful experience. So they want to share with the community under similar conditions as this letter says. All right. And then, of course, the disclaimer, prior publication not published as well, conflict of interest, all right, and then consent from the patient that is, that you must show as evidence, all right. So these are an example of good letters to the auditor, okay. And then sometimes the the journal may want you to suggest reviewer. So the reviewers are the people deciding on the article's fate, right? So sometimes the reason why the editor suggests the reviewer is because sometimes editors is a bit of hard work if they want to find the reviewer themselves. All right. So usually the reviewer are not paid. Right, they don't get paid. They do a voluntary job. They also help in other people's promotion as well. Okay, if for example they decide to accept the journal, the article, then there's a plus point for the authors, but they themselves do not get paid. All right. So suggesting a review is a win-win situation. All right, you have to win-win situation, meaning here that if possible, try to get reviewers not from your institution who are fair, who are not biased because they know you. All right. So sometimes it's good to appoint reviewers from other institutions that you do not know at all. All right. So who have who have not been in the related field but do not know you at all, because there are advantages and disadvantages if you appoint reviewers who are familiar to you. Okay. All right. So now you have got the response from the editor. Okay. Okay, it's either outright rejection, that means editor's decision, outright rejection without even going to the reviewers. Okay, so there are reasons for that. By the way, these processes are similar to as whether you submit a case report or original articles. All right. If not rejected, outright rejection, the reviewers will be given a copy of the manuscript, and then they give their judgment whether minor correction or major correction, and then major correction or reject or accept. So they can be either in this category. So let's say the editors do not reject, but they hand in to the reviewers. The reviewers will give their verdict whether minor, major, reject or accept. All right. So uncommonly the manuscript is being accepted outright. Usually there are some minor corrections to be done. All right. Okay. So here's the processes of where does your paper go after submission. Applies to any kind of submission. Okay, so at the editorial office do the checklist and the screening. This is editorial assistant. All right. It's been done, been done by the editorial assistant, not yet the editor. So they have a checklist, they screen first. And then if doesn't fulfill the requirement from the checklist, there may be a direct desk rejection. And then, it goes to the editor, okay, reviewer. The editor will select the reviewer from their pool, or some they take the author suggestions. And then yesterday somebody was asking me, how long does the process take? Okay, usually review process up to 2 months. I said usually. All right. So usually meaning reviewer to the authors. All right. and then the authors will do the amendment, correction, and go back to the editor, and then the editor will make a decision based on the comments of the reviewers. All right. So this may take a certain time as well. So the final will be accept, minor correction, major correction, or reject. So the time from editorial office, reviewer selection, review process, editor decision, accept or not, can be, I shall say, is if everything is okay, between 5 to 6 months. All right, it can be longer, but shorter than that, I think it's a bit impossible. Okay, so perhaps the shortest is 6 months before you know that your paper is accepted and going to be published. All right. So, but this is very, very, very subjective. Okay, so here, example of the comments, reviewer comments. I show examples here to show how you address the comments by the reviewers. Okay, so there are usually 2 reviewers. So here we see the comment of reviewer 1. The review 1 mentioned the author's report case of 59-year-old man with concurrent severe nausea, malaria with hyperparasitemia and multi-organ failure, and with concurrent dengue infection. This is pertaining to the case report that we were discussing earlier. All right. So the reviewer 1 gave major comments. There are 1, 2, 3, 4, 4 comments. All right. So let's look at the comment. Okay, so let's look at the first comment. So the first comment is, the reviewer said, the authors place a great deal of emphasis on this being the first reported case of nausea or dengue co-infection. However, nausea, malaria, and dengue are common in Malaysia, and co-infections almost certainly occur. Indeed, a case of co-infection has been previously reported. So the reviewer mentioned these authors, which he reported in journal in 2011. So the reviewer is saying that, these authors is overclaiming first reported case, because cases of nausea and dengue has been reported, and also nausea, malaria, and dengue are common in Malaysia, and certainly co-infection almost certainly occur, to justify the claim that the authors are claiming baselessly the first reported case. So you being the author, how would you address that? All right, so the reviewer also has inserted the case that was reported. So as if the reviewer said, okay, you are overclaiming first reported case, novel case, but there are also cases reported here. Okay, so let's see how the authors address that comment. All right, so he wrote response to reviewers. Okay, thank you for the advice. Start humbly. Thank you for the advice and comments from reviewers. So, show that you have made efforts to carefully check and revise the relevant contents in the report as was suggested. Okay, don't be in a combative mode lah. And then what they have, the authors have done is they want to resubmit for publication in a revised version of the manuscript with a revised title. So the dangers, instead of the first reported case, so they have devised, they have tweaked the title to be the dangers of accepting a single diagnosis case report of concurrent plasmodium nausea, malaria, and dengue infection. So it becomes less of overclaiming now. All right. So how do they address the first major comment in saying that, first reported case? So the response, you have to make your response. So usually, the reviewer, when they get this kind of response, they will, tone down and then get more practical. Okay, so they read this response from the authors. The reviewer raised an important concern. Well, exactly. So the response is, we apologize for oversight of not exhausting all reviews. All right. However, you still want to, do a rebuttal. However, the focus in our case is different as it illustrates the detailed case scenario. All right. That means it describes very detailed about the case presentation of the patient, whereas the reported case by William was about its prevalence. So, but anyhow, since the comment of the reviewer is an important concern for them, so that's they change the title and put more emphasis on the dangers of accepting a single diagnosis in the discussion section. All right, so they don't emphasis on the novelty now, but they emphasize that this the management, the dangers of accepting the single diagnosis. They stress on that, which is something different from the Williams paper. All right. So Williams paper is looking at prevalence. No doubt, Knowledge has been reported together with dengue in Malaysia, but this is a case report, very detailed case presentation. All right. So in accordance to that, they changed the title lah. The dangers of accepting a single diagnosis case report of concurrent Plasmodium knowledge malaria and dengue infection. So this sounds very attractive, more acceptable. Okay. Okay. So, in the end, the paper was accepted because they do a rebuttal, but in a very professional, very scientific manner. Or okay, by the same time they look back the literature and they find the subtle differences. Okay, why your paper is rejected, either outright by the editor or if it pass through the editor, rejected by the reviewers. One is it contains too strong statements, over promising. All right, example is just now that we discussed. Also over ambitious. Certain journals do not accept case report. The other reason is, you send to the wrong journal. The journal do not accept case report, but somehow you disregard the instruction you send, so it's rejected outright as well. This is also one of the reasons where it was rejected straight away. And then you don't have a good cover letter, okay, explaining why this paper is important, why the journal should publish it. Also, the abstract is not good, not informative, not good. And the other thing is plagiarism. Okay, usually detected 6 concurrent words. So that's how plagiarism is, ascertained. So pertaining to that, the message here is do not delay. So try to write case reports. Having said all that, so you need to sell you are doing a business. You want to sell your product. Here you want to sell your articles to the editor and the reviewers. Use a correct, simple formula. Repeat this numerous times. All right. So case report made easy usually consists of good case, good pictures, consent, plus thorough literature review, simple language, focus on the learning point, and cite the journal that is relevant. All right. So this is the formula for to sell your articles to the editors and the reviewers. All right. So must have a good case. What is the attractive thing about the case? Pictures, consent, so on and so forth. Okay. So this is just the check sheet. Okay, case report check sheet, which I have already described. So this is for you when when you are when I'm sharing the slides, then you can take this as your checklist. All right. So they have all the different checklists. You can, when you're writing the case report, you can use this as your checklist, whether you have comply to all the things that are mentioned here. This is a repetition but in detail. All right. So again, the introduction, the case report, So these are in detail, okay, discussion, conclusion, what you should do and should not do. Last but not least, acknowledgement. You have to acknowledge those who have contributed to the case. Sometimes you may not want to include them as authors, but they should be acknowledged, all right? References, a lot have been said about the references, okay? And last but not least, I quote another paper from the Japanese authors. So they have given tips on writing case reports for the Japanese generalists. All right. So it's found that many times the clinicians presented their case reports in conferences, in seminars, but they don't follow up. They don't write these case reports. They don't send to journals. Okay, so there are various reasons for that. So the authors here have given tips that we have already discussed high and low about the tips. The novelty, the clinical lessons, searching the background reports, and then consulting a native English speaker, blueprint detailing the writing process. But what was not mentioned is thinking about what to do if your paper was rejected. You must be prepared. If your paper is rejected, don't give up, try again. All right. So the tip here is, if you follow tip 5, the last year in brown, if your paper is rejected, you must have a list of alternative journals that will facilitate your next journal submission, and then incorporate also the comments from the reviewers if they are available. So at least you have the comments from the reviewers. All right, so you incorporate that, and then you already have the list of alternative journals. So you do this in the earlier parts without having to wait a decision from the first journal. All right, so you must have a proactive list, proactive actions by having alternative journals that you want to send to. Okay, and the last message here is always adopt a critical mindset when preparing case reports. Ask the following question: what learning point does this case offer to global readers? Will it be helpful to the reader if they encounter this case? All right, so this is the basic fundamentals. Okay, so with that, thank you for your attention, and I would like to acknowledge our anesthetist, Dr. Chong, who has prepared the slides, and also again would like to thank the organizing committee for inviting me to give the talk today. Thank you very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh, Prof. I'm sorry, Prof. Narazah. It seems like Dr. Puspa has a signal trouble, so she has been out from Zoom.
Out of radar, is it?
Yes.
I'm sorry to hear about that. I didn't realize. When was that? The signal trouble?
Yes, there is a signal trouble here. I'm sorry, can we proceed to the question and answer, Prof?
Sure.
Okay, I will share the question. This is the first question from Dr. Betty, Prof.
Yeah.
If we want to submit case report about rare cases, is it the laboratory examination must be complete for confirmed diagnosis, or can we just perform the laboratory test that we can do in our laboratory? Because sometimes some tests cannot perform in our laboratory, Prof.
Yeah, sometimes you think that you want to submit the case report for the reasons that we have described, good learning point, or, unusual presentation, all the reasons that we have discussed, but certain tests are not possible to do in the lab, all right? The answer to that is, you need not do the complete lab examination, all right? The reason why I say that is because if you have a good reason for not doing a complete lab examination, you have a good reason for not doing that, then journals sometimes will accept. Okay, but make sure that the tests are like, secondary tests, or, the diagnosis has been confirmed. Okay, these are examples. So I quote our experience, we had, I think I mentioned in the first lecture, we had our patient who had chronic anemia since young. Okay, and then she was investigated extensively, and then eventually her samples, the blood samples, were outsourced, sent for NGS. Okay, and then the NGS confirmed the diagnosis, and ideally we should investigate, get the parents' blood. In this case, the parents are still there, but we didn't get the parents' blood, and we gave good reasons why we couldn't get the parents' blood. This is to strengthen the diagnosis, whether the mutation is in trans or the cis part of the chromosome. Okay, so sometimes you are not able to provide the complete list of tests, but if the diagnosis, the patient diagnosis, is confirmed, and then the other test is supplementary, well, it's okay. All right, so it's okay unless you're not sure what's the diagnosis and you haven't completed the tests that are indicated. All right, so sometimes it's not possible to have all the tests done. Sometimes it's not available. Sometimes you need to outsource, but sometimes if you cannot outsource, you have all that available data, so be it. You still can try. Okay.
Thank you, Prof.
Welcome.
Yeah, thank you, Prof. Narazah. And now we have Dr. Puspa back, Prof.
Okay.
I'm really sorry. I have a bad connection. Just raining in my home. So the next question, Dr. Fida, from Dr. Munawaro Fitria. It should be completed with ethical clearance or enough with informed consent from the patient. Thank you, Prof.
Okay, thank you for the question. Yeah, very good question, very relevant when you're writing case reports. Okay, sharing the practice in our institute. Okay, so for example, we want to write a case series or case report. The procedure is we need to get clearance from the Human Ethics Committee of USM. So what we do is we do not present, we do not have to send any research proposal for that matter. So we send a draft of the paper to get the permission from the Human Ethics Committee board. All right, but that is not enough for the manuscript. So the manuscript wants another document that is consent from the patient. So usually it's like that, consent from the institution for you to publish the data. Okay, so in the getting the consent from the ethics board in publishing that paper, because you are publishing data from the hospital, right? So you must get evidence, you must show evidence that you are getting the approval of the director or the president of the hospital. All right, but you haven't got the consent from the patient. So the process is not difficult, getting consent from the hospital ethics committee. You just give a draft of your manuscript, and then you say that which journal you are going to publish. That's all, and they will answer in 1 or 2 days. They give approval in 1 or 2 days. Consent from patient, usually we use our consent form, our standard consent form that can be found online. I don't know about the process in university. Your university, it may vary, all right, but usually the journal one mandatory is from the patient, consent from the patient. They want to show, in fact, they want you to show evidence.
Yes, Prof. Narazah, but usually in our hospital, we cannot find the patient anymore because the patient already sent home or the patient already maybe died. So what can we do regarding this problem, Prof. Narazah?
Okay. We also have encountered that similar kind of situation. So now the hospital practice like general consent. So on admission, we will ask them to sign a general consent form. In that general consent form, we will tell them that you give permission for treatment, and then for permission to use your samples, for example, things like that. Okay, so if for example you don't manage to get that sort of information, you may want to write to the to the journal that maybe hoping that they will accept that you can't manage, you are not able to get the consent because the patient has died. But usually we can avoid that by getting a general consent from the patients. Worst comes to worst, try to get the relatives. All right, even if still difficult, then perhaps the journal want certification or proof from the director of the hospital. All right, so if you think that the case is true enough, good enough to be published, then you cannot provide the consent from the patient. So these are the alternative ways of how to go about. All right, it does happen occasionally.
It is really a good way to have a general consent, but unfortunately in our hospital, we haven't had that kind of general consent yet. Maybe later, maybe. Next question from Dr. Yuliana Darindrasari. Assalamualaikum, Prof. Narazah. For submit the case report manuscript, some journals have criteria about evidence-based case report. What is the difference between evidence-based case report and systematic review? Thank you, Prof. Please, Prof. Narazah.
Okay. Systematic review actually is sometimes you can confuse with meta-analysis, right? So systematic review is you get you focus on what do you want to study. All right, for example, you get information of, okay, what is a good example? Let me think. Let me think about systematic review. That means as the word says, systematic review is you review of all the papers talking about a particular topic. So you must have an inclusion criteria or exclusion criteria. All right. So you get the information. Let's say you want to focus from 2005 to 10-year systematic review of how to manage a patient with Kawasaki disease. Okay, what are the how do they manage how does institution manage. So this is systematic review. Example of systematic review is Cochrane review. All right, this is systematic. So they fix the criteria, they look. But as opposed to meta-analysis is using statistical methods. All right, so they look at data, but they do a statistical methods to look at the the number of patients, for example, that are affected by hematological, hematological of COVID infections. Okay, so they do a statistical analysis as opposed to systematic review, which do not have a statistical analysis. It's just a review of, review of treatment, for example, review of drugs, review of results, for example, but no statistical analysis. Okay, so meta-analysis is different. Evidence-based case reports, I think is quite a general term. Case report that has that has good evidence of treatment, for example, good evidence of investigation. All right, so I think it's a bit difficult to compare evidence-based case report and systematic review. Is quite different one from the other. Case report is a case report. Systematic review is a review of many many publications, many reports about a particular disease, for example. So it's a bit difficult to compare between these two. But people tend to be confused between systematic review dengan meta-analysis. All right.
Yeah, okay, thank you, Prof. Narazah. Next question from Dr. Rafida. Good afternoon, Prof. Narazah. Is it possible to publish case report if the patient have poor outcome after treatment, like a patient die or their morbidity, mortality after the treatment?
Okay.
Please, Prof. Narazah.
Well, actually, I didn't mention here. Usually, usually the case report will get rejected lah, especially if what do you want to share with the audience if there is poor outcome after treatment, right? Especially if the patient dies. So one is a sad story. But what exactly that you want to share with the audience, with the readers? So yeah, if you want to show that you treat the patient and then the patient dies, so what is the learning point here?
So can I conclude that we better not presented the case with the poor outcome?
Yeah.
Really, is it right, Prof?
Yeah, usually it's like that. All right. Unless, I don't know, unless there's very, I don't know, but usually, it gets rejected.
Okay, thank
especially
you,
if the patient die. Okay.
Thank you, Prof. Narazah.
Yeah. But having said that, I said usually I don't want to be caught in say, okay, it will be outright rejected. But what you want to portray is very important. All right. You want to portray that this patient has unusual presentation. Okay. So you focus on the unusual presentation. Right.
Yes.
And then you can say that eventually the patient died. It's not because of the unusual presentation, but because the disease is like that, the nature of the disease.
Yes.
But what you want to portray here is the unusual presentation, all right, which may confuse you with other diseases. If that's the case, it's still possible. Okay. Dr.
So,
Rafida?
not because of the wrong treatment.
Yeah.
Prof. Narazah.
Yeah, because of wrong
the-
treatment, it will outright be rejected.
Thank you, Prof. Narazah. Any other question, Dr. Rafida? Is it finished or still any more question? Dr. Rafida? Masih ada question yang lain, pertanyaan yang lain?
Yes, there is one more question from
Yeah.
Dr. Laurencia.
Yeah, please. Are clinician visitation daily need to be reported, or we just report the lab result from the patient? Please, Prof. Narazah, from Dr.
Okay.
Laurencia.
All right. So in this case, I gather you want to write a case report about the patient, right? A case report. All right. So the patient may have multiple lab results, right? You don't need to put all the lab results. Only put when it's related or relevant or significant to the case. All right. But again, so if it's important, the series of lab investigation results are important to the things that you want to highlight, you may want to include that. But if it's not really relevant to the points you want to highlight, it may not be significant. So you have to omit that. All right. So let's say you want to do example lah, you want to write case report about patient MRD, all right? So you want to monitor the gene mutation by real-time PCR. So let's say you monitor after six months, you may want to put the results, all the results there, which is relevant to the case. I hope I answered the question, because when I look at the question, clinician visitation daily, you mean the physician that does the round for the patient, is it?
Yeah. So Dr. Lauren, maybe you want to state the clinician visited the patient daily in a report, but I think it is not necessary also, Prof.
Yeah. I don't think it's necessary, because we want to be as concise, as clear as possible. If it's not relevant, don't. All right.
Okay. Thank you, Prof. Narazah. Dr. Rafida, already. This is
Yes,
the last
that's all the question. It's the last question, Dr. Puspa.
Ada satu lagi dari Dr. Miftah.
Oh, okay.
Good afternoon, Prof. I want to ask, in some cases that are going to be published, some reviewer get a major concern one method that has been used for the lab results. Do we have to explain the method of lab parameters? And do we have to explain the limitation of the parameters in our laboratory in the case report? Thank you, Prof. Narazah, about the limitation of our method if we are asked by the reviewer.
Yeah, I think in this case it's not pertaining to case report, right? Well, okay, it may be relevant to case report as well. Okay, this actually depends on the needs or the comments of the reviewer. All right, some of the reviewers want to know the method that has been used for the lab results, because this if they know the method that has been used, this will make them make them realize or accept the accuracy or authenticity or precision of the results. All right, so it depends on the reviewer's concern as well. So they may want to show that the results are, validated. All right. So they may want to know the more information about the method that has been used. So we have to provide that. And then, of course, the limitation of the parameters, you have to put that as well. All right. So it will be not complete if you don't mention about the limitations of the parameters, as long as it doesn't affect the major part, for example, the diagnosis part or the prognosis. Okay. So you have to explain all the parameters. So some reviewers do ask for that. They want to know the method, because maybe they are not sure. They don't have evidence to see that the results are validated, the results are accurate for that matter. So they want to have more information, and you have to provide that. Okay.
Okay, Prof. Narazah. I think that's all the question, Dr. Fidaya. So it is come to the end of this session, this lecture. Thank you, Professor Narazah, for the lecture about the case report. I hope this will give us all the benefit to improve our quality of publication, especially in case report or technical report. Thank you very much, Prof. Narazah. Maybe we will meet again later. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. Saya kembalikan ke Dr. Rofida.
Thank you very much, Dr. Puspa. And thank you very much, Prof. Narazah. I also sincerely thank to all audience for taking time to attend this event from the beginning to the end. Maybe we can take a photo for the documentation. So maybe all participants can open the camera. Okay, now I will take the shot in count 1, 2, 3. For screen 1. 1, 2, 3. And screen 2. 1, 2, 3. Okay. And finally, from the deepest of my heart, I do apologize if there is any mistake in presenting this event. And thank you very much for your kind attention. See you on the third scientific writing lecture on 16 February with the same Zoom link. Wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you.
Dilanjutkan dengan ini ya, diskusi jurnal ya.
Excuse me,
Monologi.
Prof. Narazah. I'm Taya, Prof.
Yeah.
The discussion is very interesting, so it's quite a long time. And do you still want to continue with the group discussion 10 minutes later, or we can arrange another time, Professor?
Yeah. Is it possible we arrange another time, because in Malaysia is getting quite late also. We are almost 6 p.m. and I'm sure in Indonesia, by the way, what time do you finish work?
5 o'clock, Prof.
Sorry?
Almost 5 o'clock.
Almost 5. So you
Yes.
finish work at 5 o'clock.
Yes.
All right. Okay. So it's
So-
late for both of us.
Yes, Professor. So
Yeah.
we can arrange another time for the group discussion, Professor.
Yeah.
Thank you, Professor Narazah.
Thank you very much.
Prof. Narazah.
Yeah.
Prof, it turned the small group discussion will be held by the immunology division. So, who will join the SGD? Prof Narazah, yourself
Okay.
or your college from immunology?
Okay. I've looked at the two manuscripts. All right. I think that I can give some inputs because it's also, like within my area of, practice as well. But to make it more, more appropriate and beneficial as well for my other colleagues, I will also invite one or two people to be in the discussion, especially, that day I will invite Dr. Emmanuel and also maybe, somebody from transfusion medicine as well. But I can give some input as well to the people.
Okay, yeah. Okay, Prof Narazah, thank you.
Okay, welcome.
So we can quit this Zoom, Dr. Thea, yeah?
Okay,
Okay, Prof
Yes,
Narazah.
Doctor.
See you.
Thank you, Prof.
thank you.
Thank you.
Goodbye. Assalamualaikum.
Waalaikumsalam warahmatullahi wabarakatuh.